Hi everyone, welcome back to this channel. My name is Ighonojie, and on today's video we'll be talking about the NHS. Alright, I'm sure a lot of you have heard about it at some point or the other. Someone making reference to it, saying I work in the NHS, or I've just gone to the NHS to receive treatment, or someone I know, my friend, my family work in the NHS trust, anything like that. So what is NHS? The NHS is just National Health Service, that's the full meaning, and the system that regulates healthcare in the 4 countries of UK, one of which is England, and it's just the system that regulates healthcare, and it's done in such a way that the patient is put at the center of healthcare. The patient is at the center of everything that is being done in the NHS. One of the principles is that it carries out or gives comprehensive care to the people that come to receive treatment in the NHS, and is based on community, patient and people. Like, that's just what it's about. And there is high standard of professionalism as well. Everybody in the NHS must dress cautiously, they must dress very well, and they must also put the patient at the center of the care. No matter what you do in the NHS, always make sure that your patient is the center of your care. That's what its values encompasses. All right, so also a way of trying to make sure that everybody that accesses healthcare gets the healthcare that they need, gets the care that they need, with or without money. They don't have to be having money at that particular point in time to be able to access healthcare. That's what the principle behind NHS is. It's just a way of providing healthcare services to all without having to pay at every point in time. That's okay. And you of course you should know by now that taxpayers, like the people, pay tax, and then it's the taxpayers' money that they use to fund the NHS. So it's just like you've paid your tax and you deserve to reap the benefits. But NHS does it in such a way that whether it doesn't matter how much tax you've paid in the future, in the past, or anytime. I'm making reference to the future already, but it doesn't matter how much tax you've paid or when you started paying tax. When you come to the NHS to receive health care, they are happy to receive you. They are happy to give you the care that you need, without having to calculate how much tax have this person paid. So that's one very interesting thing about the NHS. It just covers patient care. It gives high standard of care to the patient. It's based on community and people and the patient as well, most especially. And it runs across organizations. All right, so we have different health sectors in the NHS: radiography, med labs, midwifery, nursing, medical professionals like doctors, like everything, physiotherapists, nutritionists, everything is in the NHS. All right, every service also, like all these organizations, anything that has to do with healthcare, that has to do with caring, treatment, and every other thing, you can find all those organizations and all those sectors in the NHS. And it's also one other thing is that it's also an employer of labor. The NHS employs labor, like I've just mentioned, every facet, like no matter what you are, no matter what you do, if you're a dentist, if you're an ophthalmologist, if you're a nutritionist, if you're a doctor, if you're a nurse, you're a radiographer, whatever you do, a cleaner, like everything, support worker, healthcare assistant, the NHS employs all forms of labor. And that's one interesting thing about it as well. And it does this payment per hour method. It pays per hour to their staff, to the staff working in it. All right, and it's above all, it just gives the highest standard of care and excellence, and professionalism as well. Of course, you have to be professional. You have to go by the guidelines and the rules of the trust, the NHS trust you're working, and follow this to be able to render the best care possible to the patient. All right, and the NHS has 6 major values, and one of them is working together for the patients, respect and dignity, commitment to quality of care, compassion, improving lives, and then everyone counts. All right, so those are the 6 values of the NHS. And if you're doing NHS interviews, you might be asked this question, like what are the values of the NHS, and you might be asked the values of the particular trust you're applying to work as, whatever you're working as, whatever profession it is, and you might be asked the values. So you know these values, you have to know the NHS values and then know the trust values specifically as well. And then also you can find more information about the NHS in their website. You just type in NHS website or NHS and on Google or any browser you're using to bring it out. All right, so find out more information about the NHS if you need more. That's that about that, and thank you for watching. Don't forget to subscribe to this channel, share with your friends. If you have any questions, drop it in the comment section. I'll be happy to answer. Thank you. Have a nice day. Bye.